All right, let's dive right in. Today, we're going way beyond the surface, beyond the needles and the treatments, to get into the real psychology of beauty. And look, this isn't about vanity. It's about figuring out why we really want to change how we look and what we're actually buying when we decide to get a new look. So let's start with the biggest secret in the entire aesthetics industry. This quote from Dr. Ari Masudi, it just says it all, doesn't it? People aren't walking into a clinic because they want a vial of a specific product. No way. They're looking for a feeling. They're looking for an outcome. They're buying confidence. And this chart just lays it out so perfectly. It shows the massive gap between what we say we want and the deep emotional need that's actually driving us. So someone might come in and say, I want lip filler. But what they're really truly searching for is that feeling of being desirable again, maybe after a big life change. The procedure? That's just the tool. The real goal is the transformation. Okay, so if patients often don't say exactly what they mean, or maybe they don't even fully realize it themselves, how do the best clinics actually uncover that core motivation? Well, there's a really specific technique they use to do just that. It's a method that actually comes from the world of high-level consulting, and it's called the 3 whys. And honestly, it's so simple, but it is unbelievably powerful. It's all about peeling back the layers of a decision to get right to that emotional heart of the matter. Here's exactly how it works. Let's say a patient says, I want smoother skin. That's the surface goal. You ask, okay, and why is that important to you? They might say, because I look tired all the time. That's the rationalization, right? It makes sense. But then you ask why just one more time, and that's where the magic happens. You get to the emotional core, because I feel invisible at work. And just like that, the conversation isn't about skincare anymore. It's about feeling seen and valued in their career. So once you've found that deep emotional why, the whole conversation has to shift. You can't stick to the clinical, logical script. It just won't connect. You have to start speaking the language of transformation. You got to focus on the feeling, not just the feature. And just look at the difference here. It is night and day. On one side, you have non-surgical facelift using advanced PDO threads. It's technical, it's clinical. But on the other, reclaim the face you see in your mind when you close your eyes. Wow, that speaks to your identity. Same thing with mommy makeover versus reclaim your foundation. One is about fixing your body, the other is about restoring your sense of self. And this isn't just a theory, by the way. This approach has a massive, measurable impact. A clinic in London did this exact thing. They reframed their mommy makeover package to reclaim your foundation. And the result? A staggering 40% increase in bookings just from changing the language. Need more proof? Here's another great example. A clinic in Paris ran a test on 2 different ads. One was logical, advanced fillers. The other was purely emotional, feel like yourself again. And the emotional ad generated 3 times more engagement. Not a little more, 3 times. It just goes to show emotion is what drives people to act, not logic. But here's where it gets really tricky. Even when a patient is motivated and you're speaking their language perfectly, they still hesitate, they pause. And it's so important to understand the really powerful psychological barriers that can pop up at the last second and stop them from saying yes. This moment of hesitation is absolutely crucial. The person is right there, on the edge of a decision, but there are all these invisible forces pulling them back. So what is really going on inside their head? Well, research shows it's this really potent cocktail of anxieties. There's the fear of being judged by others, the fear of making the wrong choice and regretting it, even just a basic fear of change itself. And then you pile on decision fatigue from having too many options, and this huge one, guilt. A powerful sense of guilt for feeling selfish about spending money and time on themselves. So what's the solution? It is not to push harder. Pushing just creates more resistance. The real key, the secret, is to lower those psychological barriers. It's about reframing the whole thing and giving patients permission to finally invest in their own well-being. For example, a command like "you should do this" just creates pressure and resistance. But if you flip it to a persuasive statement like, when you're ready to take control of how you age, we're here, well, that's empowering. It puts them in the driver's seat. And even shifting a negative frame like anti-aging to something positive like pro-vitality can completely change the game, turning fear into an aspiration. And the results of this approach? They absolutely speak for themselves. A Toronto clinic created something called First Timer Fridays, a totally low-pressure, safe space for people who were just curious.
And by making it safe to take that first step, they converted an incredible 70% of the people who walked in into actual patients. 70%.
So, finding the why, speaking the language of transformation, lowering the barriers to yes, all of these secrets we've talked about, they all connect to one final overarching principle. This is the big one. And here it is. This is probably the most important shift in thinking you can possibly make. We all see our lives as a story, right? In that story, the patient is the hero, and they're facing a challenge. The clinic isn't the hero that swoops in to save the day. No, the clinic is the wise guide, the one who gives the hero the tools and the wisdom they need to win on their own terms. And when you start to see your role as the guide, everything just clicks into place. Your job is to understand the hero's motivation. That's the true why. You speak their language, the language of transformation. You help them overcome their internal conflicts. That's lowering the barriers. And then you provide the tool, the treatment, that allows them to write the next chapter of their own story. You know, when you really think about it, this goes so far beyond aesthetics. It's a fundamental truth about why we buy anything, really, whether it's a new car or a new phone or a new look. We are all the heroes of our own stories, and we're all just searching for the tools to help us become the person we are aching to be. So, the final question is, what's the next chapter you're aching to write?